Hi guys, my name is Jose Antonio Bustos Fernandez. I'm going to talk about, will give you an introduction of what are the probiotics. Well, the probiotics are live microorganisms that are intended to be or to have health benefits for us when we consume it or we apply it into our body. Well, we can find it on yogurt, fermented foods, or beauty products. Also, many people think that these bacteria or these microorganisms they are bad for us or they are harmful. So that's not true because there are more than 300 of trillions of these bacteria and more than 1000 species of them. They are more good bacteria than bad ones. Well, taking this in mind and thinking more deeply, we can know that they are basically and practically essential for us to survive because we have a relation with them. This relation is called mutualism. The mutualism is an ecological interaction between two or more species that they have or they get a net benefit. An example of this is the fish that's on the top of the shark. He eat all that bad cells or dead cells in his skin, so he eat it as and they take it as a food, and both have benefits. The shark eliminating these bad cells, and he with the food. Some bacteria help us to digest some food to destroy diseases causing cells or to produce vitamins. Many of these microorganisms in probiotic products are the same or as similar to microorganisms that naturally live in our bodies. This group of bacteria is called microbiome. This microbiome is a community of microorganisms that lives in our intestine. So they usually help us to eliminate or to prevent some diseases. Some bacteria help us to digest some food to destroy diseases causing cells or to produce vitamins. Many of these microorganisms in probiotic products are the same or as similar to microorganisms that naturally live in our bodies. This group of bacteria is called microbiome. This microbiome is a community of microorganisms that lives in our intestine. So they usually help us to eliminate or to prevent some diseases. Well, ending with this introduction of the probiotics, there's a national health survey in 2012 that showed that more than 4 million of USA adults has used probiotics and probiotics in the past 30 years. Among adults, probiotics and the prebiotics were the third most used dietary supplement other than the vitamins and the minerals that, as we know, there are famous or popular dietary supplement that all the people used to ask for when they go to the doctor.
Hello, my name is Emilia Estrada and I am going to talk about the properties of probiotics. For a start, probiotics are live microorganisms that provide numerous health benefits to the host when supplied in adequate amounts and improve the intestinal microflora of the host. Eli Metchnikoff, who is regarded as the grandfather of probiotics, mentioned the beneficial properties of probiotics. He discovered that the lactic acid bacteria have a positive influence on digestion and immune system. Probiotics must survive through the gastrointestinal tract conditions and stay attached to the human colon to provide the health benefits. That's why they need adaptation to the conditions of the target cavity and good adherence to the overlying epithelium. And that's why organisms with the same origin are preferred in these cases. They do the generation of antimicrobial substances, the absence of resistance transmissible to antibiotics. In other way, probiotics organisms are used in a very wide range of situations, which includes healthy individuals, healthy people, but in a special situation like babies, pregnancy women, lacting women, and other adults. Two, they are used in diseases of different types and conditions that I think my partner Pero is going to talk about later. Following with the information, we can see through the years that the consumption of probiotics is increasing. They become universal thanks to its inclusion, among others, in numerous fermented dairy products. They represent a direct way of optimizing the relationship between the microbiota and the organisms. Well, to conclude the properties of probiotics, we enlist the main characteristics that they need to have to become effective. They are non-pathogenic and non-toxic. They are able to maintain the good viability. They have anti-inflammatory, anti-mutagenic, and immunostimulatory characteristics. They have stability during the processing, storage, and transportation to the gastrointestinal tract. They are able to survive the passage through the digestive system. They are able to utilize the nutrients and substrates in a normal diet, and they are able to attach to the intestinal epithelia and colonize.
Hi, my name is Veronica, and I'm going to show you some of the recommendations for the use of probiotics. So, why should we use them? Our body is home of trillions of organisms. The right variety of these organisms can keep us healthy. Different types of organisms have different jobs. Some keep us healthy by fighting other organisms, and others interact with immune cells to reduce inflammation. Also, they prevent allergic reactions. When we eat organisms in our gastrointestinal tract, they eat too, and sometimes the number of good organisms can get low. For example, if you have diarrhea or if you are consuming antibiotics. When this happens, taking probiotics may help to increase the number of good organisms in your gastrointestinal tract. So, which species of probiotics are helpful? Some of the probiotics species that have demonstrated a benefit include Lactobacillus, Bifidobacterium, Leuconostoc, and Streptococcus. And what are the risks of taking probiotics? Some studies have demonstrated that there are very higher risks or side effects about taking this, and they are considered safe for most of the people. However, they may cause problems in people with cancer or in people who do not have a normal immune system. Rarely, probiotics have caused a serious blood infection in people with cancer. So, what should we know when buying probiotics? It's important to read the label and think of the 3 Ds: diversity, dose, and delivery. Diversity means that there are a lot of different species included, not just one. Dose is measured in colony forming units, or CFUs. You should aim for at least 10 million of CFUs per species. And delivery is the way you will take the probiotic, like enteric coated capsules that make it more likely that more probiotic cells will reach your intestine. Probiotics can also be taken as powders, gel caps, gummies, liquids, and foods such as yogurt. Delivery affects the dose that makes it into your intestine. Choose a delivery method that is easy and comfortable so you will be more likely to use or to take probiotics regularly. Now I'm going to show you some gastrointestinal conditions and recommended products for each one. Like colic, the recommended probiotic is Yarrow Formulas, Baby Yarrow's, Nature's Way. These are some brands of probiotics. It has been proven that it prevents the diarrhea, and it can be a treatment also for diarrhea after taking antibiotics. There is evidence that it prevents the Clostridium difficile diarrhea and the radiation-induced diarrhea. Also, the Helicobacter pylori eradication, the hepatic encephalopathy prevention and treatment, and the immune response, it increases. Also, it has a job in the inflammatory bowel disease and in the irritable bowel syndrome. The literature suggests that certain probiotics may relieve the symptoms of these diseases and improve the quality of life in patients with functional abdominal pain. It is important that before we consume any probiotics, we need to contact a doctor or a nutritionist to know more about it and to know how to use it. The duration of probiotic use depends on the clinical indications. A lack of clear guidelines on when to use probiotics and the most effective probiotics for different gastrointestinal conditions is often confusing for family and physicians and also their patients.